The troops are gathering. It's 5 to 3. It's Friday, it's 5 to 3, not quite crackerjack. Welcome everyone to this final session in today's meeting. My name is Blair Smith. I'm an academic and clinician at University of Dundee and NHS Tayside. And it's my pleasure to introduce two speakers in this session. The first is my colleague, Karen Nicolson, who's a GP in Dundee and a clinical academic fellow. And she's going to give us a talk about her research, which is, I know she's passionate about, which is the relationship between childhood adversity and chronic pain in adult life. So Karen, if you're ready, do you want to go ahead?
Thank you. Good afternoon, everybody. So as Blair says, I'm going to talk about a systematic review I've been working on with a team in the chronic pain group in Dundee that's entitled "What is the Association between childhood adversity and chronic pain in adult life?" So to introduce childhood adversity, many of you may know about it already, sometimes called ACEs or adverse childhood experiences. That's a relatively new term. It was first coined in, well, maybe not that new now, 1997. But prior to that, we thought about childhood trauma in the terms of emotional, physical and sexual abuse, but didn't know a lot about family and household dysfunction. And childhood adversity encapsulates all traumatic events that can happen in childhood. And over the last 30 years, more research has shown that childhood adversity is linked to physical and mental ill health later on in life, and then early death, as the pyramid diagram shows here from the CDC. And as it also shows, there's lots of scientific gaps to connect these things. Chronic pain, again, this will be very familiar to most of you, but is a pleasant, unpleasant sensory and emotional experience, and is pain that persists or occurs for longer than 3 months. And the prevalence is, it's in Europe, it affects millions of people across the world, and is estimated to impact 28 million people here in the UK. And as I see on a daily basis in my clinical work, impacts people's quality of life, relationships, causes financial strain, and as has already been mentioned today, lots of healthcare utilisation, and childhood adversity has also been linked to increased healthcare utilisation as well. So using 6 databases, we worked out our search terms. Childhood adversity has many terms. As you can see here, we tried to search for as many as possible whilst looking at chronic pain, long-term pain, persistent pain and physical suffering. And using the PRISMA methodology here, you can see we started with 2,032 studies, and after screening and assessment, we included 64 in our narrative synthesis. So our inclusion criteria was original results that was looking at chronic pain experience in adults that had childhood adversity. We were looking at chronic pain, any chronic pain condition, to try and determine any biological, psychosocial, or any connections between adversity and chronic pain. And as the table shows here, the majority of our studies were cross-sectional. We looked at demography, where were the papers from, what chronic pain was studied, the cohort size, age, gender, the type of adversity experienced, and the assessment methods that were used to determine that adversity. The next slide is a bit busy, I apologise, but it really just shows that the main type of adversity that was looked at and was emotional, physical and sexual abuse. There are many more adversities, as I've already mentioned, and I'll talk about that in a following slide. The main types of pain that the review showed was non-specific chronic pain, headache, migraine, chronic pelvic pain, fibromyalgia, as well as other forms of pain. But the main one was non-specific chronic pain alongside pelvic pain. So the assessment methods that were used predominantly was the childhood trauma questionnaire that doesn't go into a family or household dysfunction, parental loss, bereavement. It focuses mainly on emotional, sexual and physical abuse. Other types of adversity that were picked up in the review were neglect, other forms, specific forms of neglect, or affectionless parenting, emotional deprivation and attachment, as well as bullying, overprotective parenting, and parental mental health. And if there was this is one of the official ACEs from the ACE questionnaire, if a parent was in prison, or again parental loss. So the main results, the conclusions that are from the studies, we looked at the impact from the main conclusions from each of the 64 studies. The greater the number of adversities, the more detrimental impact you'll have on your pain experience. There was 33 studies that concluded with this. Other conclusions were that current mental health and stress negatively impacts on adult pain, and that childhood adversity should be screened in those who experience chronic pain. The particular mental health that was mentioned throughout the studies and it's been mentioned a lot today already, is anxiety, depression, PTSD, but not only from childhood, but ongoing stress and catastrophization as well. Many studies concluded that much more research needed to be carried out, and education on the impact of childhood adversity needs to be more widespread. But also that if childhood adversity has been experienced, then that can have impact on in terms of effectiveness of treatments, and of course early intervention, preventing childhood adversity from happening is key. So just the main themes that we across the studies were that several studies document that the greater number of adversities correspond with more pain, more sites of pain, more severe pain, but also a greater impact on the functionality of people who do experience pain. And then again, they recommend screening specifically for childhood adversity and mental health when we are assessing people with chronic pain. There were, of course, strengths and limitations to the study. We analysed a wide variety of chronic pains and adversities across different forms of assessments, be that independent questionnaires or interviewing. Most of the studies did note recall bias, given the retrospective nature of most of the studies. And then, of course, there may well be search terms that we've missed just because of the nature of the complexities of the subjects of chronic pain and adversities. And we carried out a narrative synthesis just because of the complexity of the data and the different types of studies. So just to conclude, there were high levels of childhood adversity. The one that sticks in my head is that 75% of people in one study had experienced childhood trauma and had chronic pain. The underlying mechanisms remain debated and unknown, and more research needs to be carried out. I think more research needs to be carried out in terms of family and household dysfunction, because the majority of the studies focused on specific types of childhood abuse, and we know that family and household dysfunction can be detrimental as well. And the importance of childhood adversity in assessing and managing chronic pain needs to be recognised. And further research to determine effective management options for those who have experienced childhood adversity and developed chronic pain in adulthood needs to be carried out. And of course, prevention of childhood adversity is paramount for future health and well-being of populations. So the key take-home points for me are that there's generally consistent evidence that a wide range of childhood adversities are associated with chronic pain development, severity and functional impairment across a wide range of chronic pain conditions. Chronic pain and childhood adversity are prevalent in society. Prevention is crucial. Scottish Government has a quote that children should grow up loved, safe and respected, and much more research is needed. Thank you for your time.
Thank you very much indeed, Karen. Very well presented. A lot of papers, 64 papers to include in a systematic review. It's a great deal of work, very clearly summarised. if anyone has any questions, I think I'm reading the right chat line down the side of my page. I haven't seen any questions yet, but if you have any questions, then please type them in there. I'm interested, and I'm going to link back to one of the posters. I think it was the first poster that Leslie presented earlier, which was about the role and the benefits or potential benefits of specifically asking and then acting upon history of adversity. And that was in the case of fibromyalgia in a pain service. Do you think we should be doing, as a GP, do you think you should be doing it?
Yeah. I do see on it. I mean, I can think of a patient just from this week that if you ask the right questions and then looking back through, Leslie was talking. I do. I think people are will tell you their story if you ask the right questions. And yeah, it's something I'd like to see more research on the benefits of doing it. And
and the potential harms, of course.
Yes. Yes.
And then Leslie's actually asking a question. Leslie Dean is asking if you have a view on the role of adulthood trauma. So why is it just childhood trauma that causes this, or is adulthood trauma relevant as far as
I think it is. In fact, there's one of the papers that comes to mind just talks about the connections of childhood adversity on adulthood trauma and just the cycle that continues. A paper by a gentleman called Riedel, I think is the paper, and perceived stress or ongoing stress was definitely implicated in people's pain life in adulthood. So I think it's all connected. I didn't specifically look at adulthood traumas, but I do think it's connected, of course. Yeah.
It is an interesting point, isn't it? Because there's no obvious, it's an arbitrary cutoff point, isn't it, that determines adverse childhood experience from adult.
Adult
experience.
Yeah, and I think one of the papers says that we're not very good about asking about particularly domestic violence in primary care. But I do ask people whether or not they're safe in their relationships quite on a regular basis. But yeah, I think there's more research to be done there for sure.
That's an excellent example to choose. And then Phil Sizer was asking, and I know you touched on it briefly, but he's asking what's the mechanism by which complex trauma leads to the development of chronic pain. And he's mentioning the effects of allostatic load and a narrowed window of tolerance.
Yeah, so a few papers came up in terms of looking at cortisol dysregulation, but again, more research is needed to be done to determine the actual pathophysiology, and of course the hypothalamic pituitary axis and impact on that is you see that in lots of different papers, but nothing absolute has been determined as yet.
And that would fit with the allostatic load stress-mediated mechanism, which I think Phil's implying or inferring. And of course, the thing that did also kind of back that up was your finding that in a number of papers, the greater the number of adverse experiences, the greater the likelihood and severity of chronic pain experience in adulthood.
Yeah, definitely.
Maybe the last question from Tim Hales. And I don't know if you will have an answer, but what is the answer to was it possible to determine the type of adversity that had the greatest contribution to pain vulnerability?
So I think one of the papers that come to mind are that sometimes there was a gender difference in that. I remember again a lot of the studies were predominantly female, not particularly, but I remember one that men who'd experienced physical abuse were more likely to experience chronic pain. But I think probably could extrapolate some more data along those lines. But at the moment, no, I was just mainly looking at the sort of general impact of more adversity on chronic pain, but not specifically. But I think I would be interested to know about different adversities and why some people experience different chronic pains, having experienced different adversities, but that'd be really complex, I think.
Well, it is complex, and we'll draw it to conclusion there. Thanks very much, Karen. You presented a really good and interesting sort, and lots to discuss there. And of course, just to advertise that Tim will be answering some of his own questions with the Advanced Pain Discovery Platform project that consortium that he's leading, called CAPE, which specifically looks at adverse experiences and subsequent chronic pain in combined retrospective and prospective and animal models. So watch this space, and hopefully you'll be able to contribute to that.
Yeah.
So thank you very much.
Forward to that.
To you, Karen.
Thank you.
If you can maybe stop sharing your screen.